Imagine having the opportunity to take a blank piece of paper and creating anything that you want. That's what happened with this clinic. Once we got the go-ahead and we knew what was going to happen, an architect came in and sat down at the table with the people who were going to be the providers in the clinic and said, "What do you want?" I'm Keith Lester, and until since June 30th of last year, I've been retired from the position of superintendent of schools in Brooklyn Center. I came here in 2005, served in the position through 2013 then, so it was a total of 8 school years. For the first couple of years it was building and looking, but ultimately we developed a full-scale, full-service community schools model for the district. One of the meetings that I attended regularly, monthly, was to go to the Healthy Communities meeting that was sponsored or convened by the Park Nicollet Foundation. At those meetings you had social service organizations, agencies, you had providers of different types, you had schools represented, school nurses as well as school administration. And the whole idea was to talk about the needs of the health and wellness of the community in Brooklyn Center, Brooklyn Park. And the meeting that was most memorable for me was the day that we were talking about the high needs, the unusual, the extreme needs of the area in northwest Hennepin County. And they were talking about that we had the highest teen pregnancy rate, we had high health disparity concerns, we had high poverty, and can you believe it, they say, there is no community clinic in this area.
My name is Victoria Crook, and I am the coordinator in the clinic. I've been with the clinic since they opened. We have many resources available for the students. We have the most important one and most popular has been the medical services, because they are free for all the children from 0 to 19, regardless whether they have insurance or not. The doctors come from Park Nicollet, and they're here twice a week. We don't need to make appointments. It's a walk-in clinic. We also have the dentist that comes in every Monday, and we see students from the high school and Earl Brown, and also from the community. For the dental, you do need to have an appointment, and we also work with children that do not have any insurance.
The mental health people said, we really like a room with a window. The physician said, we don't want any windows in our exam rooms. And lots of things like that were discussed, how to deal with sound and privacy. And all of those things were taken in notes. And then the architect looked at the space and came back to the same group of people, the people who were going to be working in that space, and said, what does this look like? And then we said, wow, that's what we were looking at. But how about this and how about that? And they made those changes. And it was amazing, because this space now looks exactly like the people who are out there working in it right now wanted it when we first started planning this whole thing. It's amazing. It was a blank slate, and it was all ours to fill up, and it was a really gratifying, satisfying experience. And frankly, that maybe makes it unique to some other experiences when you're trying to develop something like this, when it's sort of handed to you saying, here's what you've got, now try to make it work. What we got was, what do you need, and how can we help you make it work? And again, we have to thank Park Nicollet Foundation, but all of the partners that they brought in, and then of course all of the partners that were around the table at the time too.
Hi, I'm Dr. Allison Stoltz. I'm a family physician, and my main job is with Park Nicollet. But one day a week, every Tuesday, I work here at the Brooklyn Center Health Resource Center, which is a community clinic housed here in the junior high school of Brooklyn Center. I was first involved with this clinic 4 years ago when we were planning, the very early stages of planning. And the goal has always been to get kids healthy and keep kids healthy so they can learn. When I come to clinic every Tuesday, my goal whenever I see a kid is to treat whatever is keeping them from being in class so they can get back to class and learn. Whether that's a sore throat, whether that's the stomach flu, whether it's that they need new glasses because they can't see the blackboard, whether it's they need a hearing test to determine that they can't hear what the teacher's saying. Whatever it is, we want to fix that problem to get kids back to class so they'll be learning. We also see babies and toddlers, and the reason for that is we want kids to be healthy, learning everything they should, so when they start kindergarten, they're going to be ready to learn right from the start. Once again, hearing, vision, making sure they have their vaccinations, treating ear infections, colds, coughs, that sort of thing. It's simple stuff, but it all adds up to a healthy kid and a kid who is ready to learn. That's why I love my job. I feel every Tuesday that I come here, I leave saying, yeah, I did something today that matters. And I look forward to my job, and it's really what I love.
We have a number of mental health providers from different agencies. We have North Psychology Clinic, and they see students that have insurance. We also have Family Partnership, and they see students that do not have any insurance, as well as students that do not speak English. We have different interpreters, different therapists that speak different languages. We have POR Wellness, and we also have a full-time therapist from Family Partnership that's going to be here in the clinic, as well as the BCA Academy, and also Earl Brown Elementary.
A couple of years ago, Dave Durenberger, who was a U.S. Senator, who's been active in the healthcare reform venues these days, or at least was at the time, came to visit the clinic. And a number of the partners were around the table, and when he was all done with the visit, he looked over at us and he said, "Okay, who's in charge?" And we all kind of look at each other. And I'm sure that when he looked at us, he thought we were kind of stupid because we had this kind of, well, I don't know. And he said, "No, who's the CEO?" And finally, Chris Johnson, who was the Park Nicollet Foundation representative for this, spoke up and said, "We don't have one. We all have a single purpose, and we all sit around the table and we do what's right, and we don't let egos get in the way, and we certainly don't let power get in the way." And I think the success of this has been just that there aren't egos and that there isn't power. And when they have stepped in and they raised their ugly heads, they've been set aside because they're reminded of what our mission was and what our vision was for this clinic. I'm proud of that, and I think everybody that you would talk to on the committee, the organizing committee, as well as those that are still operating, would tell you that's something they're proud of too. I hate sitting around watching when we have a problem and not doing anything, and we certainly stood up and said we're going to do something, and it was accomplished in fairly short order. So congratulations, Brooklyn Center Health Resource Center. You have a lot to be proud of. From what I hear, it's getting bigger and better, and I love to hear it. Keep up the good work.
Hi, my name is Leah Post. I am the health educator at the Health Resource Center for Brooklyn Center High School. I work under the Hennepin County Better Together Hennepin grant. It is a grant funded through the Office of Adolescent Health, and I work part-time at the clinic doing sexual health education with the young women there. My program is called the Safer Sex Intervention. So I work one-on-one with 13 and 19-year-old girls on pregnancy prevention and STI prevention. The clinic is amazing and unique, and I think everyone should be able to have something like this at their school. The fact that I have been able to work with these wonderful partners and with this fabulous clinic and the wonderful teachers at Brooklyn Center has been wonderful, and I hope to continue my work with them as long as my grant allows. The program itself is in the high school, and because I have such easy access to the students, it makes my program much more successful, and it's much easier for me to get all of my goals reached because of the way that the clinic's set up in the school. All the partners make this possible, and without them, I wouldn't have had the opportunity to come and work for such a fabulous school and such a fabulous group of kids. So especially thanks to those who started the clinic. I was not here in the beginning, but I'm glad that they thought of it and glad that they brought everyone together to make a really cool and unique place. And every time I tell people about where I work, they're always really impressed, and I'm impressed every time I come to work.
Buenas tardes, mi nombre es Yolanda Gamillo, madre de 4 hijos que vinieron aquí a la high school.
My name is Yolanda Gamillo, and I have 4 children that came to this high school.
Y recibir la noticia de que esta escuela tenía una clínica me pareció muy interesante.
And when I got the news that this school had a clinic, it was a very interesting idea.
Y de la manera que me ha ayudado a mí es ahorrar tiempo,
And it has helped me, this clinic has helped me by saving time.
porque aquí mismo les hicieron los exámenes físicos a mis hijos.
Because here is where they have their physical examinations.
Y además saber que teníamos acceso a esta clínica siendo que vivíamos tan cerca,
And knowing that we had access to this clinic, being also so close, our home so close,
me pareció una bendición.
it was a blessing.
Además que su personal es gente muy amable
And the people that work here are very friendly
y bien disponible para ayudarnos.
and always available to help.
Sí, yo doy muchas gracias
Thank you,
a aquellas personas
all the people
que hicieron posible
that made this possible,
que esta clínica existiera aquí.
made this clinic possible here.
Así que muchas gracias.
Thank you very much.
A really satisfying experience. And I look back on it now, and I say this is an example of you can put off, you can understand the urgency, but put off the taking care of the business, not intentionally, but because there's so much to do to get started. And once you can make that push, you understand the urgency, and then you push it, you have success. And that's what happened here. Park Nicollet Foundation, their partners, their suppliers, their contractors, all of the providers that were involved in this all stepped up and pulled it together. So we got action, we got collaboration, and in the end, we got results. And it was a marvel. It was about a $300,000 remodel that happened here, and the school district paid for the alarm system.
Gracias, doctores.
Thank you.
Thank you. Thank you. Thank you. Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
We are the kids from Earl Brown, and we want to say thank you.
You don't make things like this work without key partners, people who are particularly committed, both in terms of their genuine interest, but also in terms of their financial and other kinds of resources. And Park Nicollet and Park Nicollet Foundation were the heart of what made this actually happen. Now, we needed everybody else to pull it off, but if they wouldn't have been there, we wouldn't be here today.